All right, well, welcome everyone. We will go ahead and get started. We have a few housekeeping items to go through before we dive into our content today. But welcome to our webinar, Motivational Interviewing and Medical Respite Care Programs. Before we go into the content of today, we do like to start all of our virtual convenings with a land and labor acknowledgement. Although we are all here together in a virtual space, we are all in fact interconnected by the land beneath us. Most of our communities reside on unceded ancestral lands or those acquired by unhonored treaties. We want to acknowledge the people of these lands, past and present, and honor with gratitude the land itself and its people. We also honor the brilliance and humanity of all immigrant labor, including voluntary, involuntary, trafficked, forced, and undocumented peoples whose contributions remain hidden in the shadows, but still contribute to the well-being of our collective community. We also honor by recognizing the land that was taken from first Americans and the forced labor that was provided by enslaved Africans and Black and Brown people, we strive to take steps towards creating a more equitable and just world for all of us. And if you're unfamiliar with your own history of the land that you are residing on, you can go to nativeland.ca and learn more about the Indigenous peoples of your community. As I mentioned, we are in a virtual learning environment today. This is a webinar format. However, we want to invite some interaction. The chat feature is open and our speaker has invited you all to present questions and thoughts throughout the presentation into the chat. We also have a Q&A feature if that's more comfortable for you to submit questions that way. We'll be looking in both places as we'll have time for Q&A at the end of our more didactic presentation in breakout groups. We will have breakout groups as part of this, so we encourage you all to turn your cameras on as possible to facilitate interaction and conversation within those breakouts. But most importantly, just really encourage you to make the most of that time to learn and connect with each other and apply the information presented. Basic housekeeping, this recording and the slides will be posted to our council, the NHCHC website under the webinars tab. It takes us a couple weeks to get those things posted, but just know that this recording as well as the slides will be available to you after today's webinar. And then when we are in the chat and when we are in our breakout spaces, we want to make sure that we're using inclusive language and avoid stigmatizing language, especially when we're discussing potentially challenging scenarios or client information or cases that maybe motivational interviewing will be a useful resource for. And just most of you all know, but just as a reminder, we're here with the National Healthcare for the Homeless Council. We're your organization for support, training, and technical assistance. And our mission statement is located here. The National Institute for Medical Respite Care is a part of the National Healthcare for the Homeless Council. We're the arm that's really focused on medical respite programs specifically and support you all. So if you have questions, of course, please reach out to us and we look forward to talking with you. With that, I'm going to turn it over to our speaker, Megan Murphy, who we're thrilled to have here today to talk more about motivational interviewing.
Hi, everybody. I am absolutely thrilled to be here. I would love it if folks would take a moment to throw in the chat just where you're from, what agency, and what town you're in. It'd be nice to have a sense of who's with us. As Caitlin said, my name is Megan Murphy. I work with Catholic Charities of Northwest California. We have a couple of medical respite shelters. And I have a deep love for motivational interviewing. I've been doing training in motivational interviewing for about the last 13 years. So really excited to share it today. Certainly in our training today, we're not going to leave with folks necessarily feeling like you have a broad and deep understanding of motivational interviewing. But my hope is that you do get a familiarity with what it is and how it can benefit your work in medical respite care. So, oh my goodness, I am loving this. We have folks from Colorado and Chattanooga. We got all over the country, Phoenix. This is amazing. Welcome. Thank you all for being here and taking the time to spend with me. Also love that we have Oakland represented, not all that far away from where I'm at. So my training is in social work. It's where sort of my heart is. And I started learning motivational interviewing when I was working with youth who were in the juvenile justice system, and looking at how do we engage people around their own life choices in ways that really honor their dignity, but help them move towards greater health and well-being. And so today, my hope is to give you sort of a broad overview of what motivational interviewing is, and then from there to look at like, how do we adapt and apply it to medical respite work? And so I'm going to jump in. Motivational interviewing was developed in the 80s as a response to wanting a new way of engaging people who had struggled with alcohol use. And the idea that they wanted to find a way to engage that really honored people's humanity, that was coming together to work with people rather than sort of the old model of the practitioner being the expert that comes in with all of the advice and knowledge and tells people what to do. So you'll see throughout our conversation that the relationship that's formed between the person who is endeavoring to be the helper and the person who is struggling in a place of ambivalence is of paramount importance in motivational interviewing, and really setting up that relationship from a place of deep honoring and respect of the individual is key to what we're trying to do. And so it's an evidence-based method for promoting change and growth. So when we think of where motivational interviewing fits in our work, it's all around sort of these behavior changes. And so in our work in respite care, that can be everything from whether somebody is following the orders that they got from the hospital before release, to following the rules of our respite shelters to be able to maintain their bed, to drug and alcohol use, addressing legal problems or challenges, really anything that somebody is feeling ambivalent about and looking to make change in is a place that we could call on motivational interviewing as one of the tools that we can bring forth to support our folks in addressing that change. So it's a particular way of talking with people about change and growth to strengthen their own motivation and commitment. So it's really a practice of working with folks to find from inside why they want something different for themselves, and how they want to get there, and to empower our clients to move towards that. I think that, in life, we all have a million things that we want, and if we could be convinced that we were capable of making them happen, we'd probably go for it, right? So it's really helping our clients figure out what do they want for their lives and how can we help them feel stronger and moving towards it. There's a tremendous amount of research behind motivational interviewing. So as of 2022, we're looking at more than 1,900 controlled trials. So there's a lot of evidence behind it. And it started in addiction medicine. It's been in healthcare for many, many years. And so there's a lot of sort of strength to it. There's a lot of good research that's kind of behind why we look at it as an intervention. It's not something that we don't know if it works. It's something that is well researched. And it's applicable to our staff at all levels. People don't need to come in with a clinical degree or a medical degree to be able to use motivational interviewing. So, for us, a lot of the folks working frontline with our participants in our medical respite shelters are new into the field. So learning MI has to be accessible for our folks. And so we'll talk a little bit about how that can happen, but it can also support their clinical skill development in just some of the core fundamental aspects of how we want our new staff and our long-term staff to engage with clients. I should say before I go on too, if you have any questions or thoughts that you want to throw in the chat, I'm happy to respond to things as we go through. For me, the key components we're going to touch on today is the spirit of motivational interviewing. That's the how we are with people, how we show up in the room, the core skills of motivational interviewing. What is it that we're actually doing? There's 4 concrete tasks that we work to accomplish in motivational interviewing. We'll talk a little bit about change talk and how we set up how and why we set up our conversations to look for change talk and motivational interviewing and how that helps people make changes. And then we'll talk about the cultural relevance and how we can adapt this intervention to really serve effectively people from different cultural backgrounds. So starting off, the key part of learning motivational interviewing, and part of what we're finding is the most important piece, is the spirit of motivational interviewing. It's the question of how we show up in the room with the people that we are endeavoring to help. So there's 4 components to the spirit of motivational interviewing: partnership, acceptance, compassion, and empowerment. And partnership is really that feeling that our clients are just as much an expert as we are, and that we're joining together their expertise in their lives, their values, their goals, their culture, their history, with our ideas of healthcare, of homelessness services, of stress and coping interventions, of planning, and together in true partnership, we'll work to help them get to where they want to go. So it's a very client-directed practice. And it came sort of formed from Carl Rogers' work in client-centered counseling, but it is a little bit more of a guiding practice than Carl Rogers' work was initially. So it's coming together and looking at what is it that we can do with our skills pooled together. The idea of acceptance is really looking at our clients with the utmost dignity, respect, and acceptance that they are in charge of their lives. Sometimes out of a profound desire to help people, we really, really want to convince folks to do what we consider to be best for them. And this idea of acceptance says that though I want what is best for you, I also have a profound acceptance and respect for your autonomy. So we're out of a role of feeling like we're there to save somebody from themselves, out of a role from feeling like we need to convince somebody to do something, but that we're really seeing this whole person, believing that for all of us, the arc of our lives is a desire for greater health and well-being, and that we're going to remember and remind people of their own autonomy and their ability to make these decisions for themselves, and that we want to create a place where they know that they're seen for all of themselves, not just their illness, their challenges, but that we're finding and affirming the things that are amazing about our clients, so that they see and feel actual true acceptance. Compassion, that we are working to support our clients in their best lives and best healths, and empowerment, that our work is to remind our clients of their greatness, to help them find that, and to empower them to make changes, to draw on their strengths, their abilities, their successes, and then to look at how are they going to use that and wield that to get to where they want to go. So if we can really settle into an approach that relies on the spirit of MI as its core direction, then we see folks start to be more open to change. And there's something in there about people, one, feeling like somebody really hears them, understands them, cares about them, that somebody believes that their life can be better and that they can make that happen. And there's a part of it that also takes some of the power struggle out of our conversations, because often our clients feel like we're there telling them that they have to take their medication, that they have to be in shelter. And when we step back and acknowledge for folks that this is their life and that we would love to support them if that's what they want, but that it's their choices. What I find often is it takes some of that power struggle out, and people can really look at what they want for themselves without it getting caught in as much of a sort of back and forth conversation of you can't make me. Because I truly believe that we all have living inside of us an inner teenager that holds on just for the sake of holding on sometimes to an argument. So That's the spirit of MI. And in learning motivational interviewing, it is where we start. It's where our exercises start with staff. It's where I do a lot of training with new staff around sort of their language, particularly the language of acceptance and autonomy, and looking at using some metaphors. I talk with folks about like putting down their superhero cape, because if I feel like my job is to step into our medical respite and make sure that all my clients do all the things they're supposed to do, and that they're not using any drugs and alcohol, and they're taking all their medications on time, and they're going to all their appointments, and they're exercising, and they're eating well, and they're letting go of negative relationships, then I'm likely going to feel resentful of my clients for not doing those things. As opposed to if I can engage from a place saying, I trust that you want something better for yourself, and let's figure out what that is, then I get to come in and be helpful without feeling responsibility for forcing something to happen. So I hope that makes sense. But really looking at how we bring the spirit of MI into all of our conversations with staff has been an important part of moving sort of forward and having a really strong supportive relationship with our clients. Okay, so once we have the spirit of MI, motivational interviewing also draws on 4 core skills. The acronym for them is OARS, which is why you see some OARS in the picture. The nice thing about the core skills is they're generally not skills that are new to people who've been doing other sort of counseling training or active listening training. We use them a little bit differently, but they're skills that sort of are already building on a foundation that a lot of staff will have. So one is the use of open-ended questions, as we're looking at really wanting to empower folks and remember sort of their wisdom and remember their goals for themselves. These open-ended questions are going to be what helps give them the space to share their voice. And so looking at questions that are meaningful, that are directive towards change, and that really give an individual a chance to sort of unpack for themselves what it is they want, how they want to get there, and what kind of support they might need. That being said, we often, as folks are learning, can get stuck in questions. And so we're going to really want to balance that and use even more reflections, because otherwise it can feel a bit like an interrogation if I'm going question, 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 and my client is just supposed to answer without me sort of acknowledging what they said. So we have our open-ended questions, but we don't stop there. We have our affirmations, which is really about seeking and acknowledging and highlighting every value, strength, effort, success, tenacious, following through when there wasn't a success that we see from our clients. And the more that we can help them settle into and hold and accept the fact that they have strengths and abilities, the easier it will be for them to imagine that they can make change. It can be really hard to want something to be different in your life and to feel completely powerless to make that happen. And unfortunately, many of the situations that many of our clients have been through have reinforced an idea of lack of ability, of brokenness, of weakness, right? And so we have a lot of work to do to balance that out and helping people see all the ways that they're strong and that they're wonderful. Our reflections are a way of sort of offering back what we're hearing from our clients in a way that helps them to see for themselves what it is they want. And so it's not sort of the parroting back, this is what I heard you say, but it's that deep undercurrent of what we really are understanding people to mean in their heart, in their stomachs. So we're reflecting on what we hear from them as far as their values and their goals and how having life be different could benefit them and bring them more peace, more joy. And often with our clients, they're not sharing their change always in a, I really want to be healthier. I think it might be nice to be sober. It can be packaged in, I effing hate this life and want to stop being so sick, or I wish I didn't have to live in a shelter with a bunch of other people. It's still change, right? We're still hearing people say they want a life that's different, that they want to feel well, or they want to have a place of their own. And so for us, part of it is like finding that change and being able to reflect it back in a way that empowers people to see it as a place that they can move towards, or to have the energy to move away from the thing that they don't want. So we're really looking at, as people are sharing and as we're kind of opening conversation, to pull out those things that are going to help remind people of where they want to go, what they want, how they want to get there. And again, this isn't us saying, this is what I think you should want, but it's us really being able to open the door for them to be able to share, and then for us to be able to highlight for them what they're saying that they may not necessarily even be aware of. And then our summaries are kind of looking at all those things somebody shared and offering it back. So in motivational interviewing learning, we're looking for staff to really very intentionally set up that conversation with a client, to use these skills to guide somebody towards their change talk, right? So our open-ended questions are asking about what it might be like if somebody didn't have the struggles with the health conditions they have now, or what it might be like if somebody wasn't dependent on drinking or wasn't drinking as much, or what it might be for them that they've thought about trying to do to get their blood sugars under control, what they might have heard other people doing. And then in that, as we've sort of opened the door specifically towards a change somebody's looking at, then we're looking at what strengths are we hearing and how do we share back with people what it is they're saying. Because there's something really profound for folks in hearing back what somebody has heard them say. And it's also far less insulting. So one of the examples that I give when I'm doing in-person trainings is I talk about like perpetually wanting to eat better. And if somebody felt like they were responsible for convincing me to move forward on that, they'd probably be pointing out all the reasons it would be good, that I would lose weight, I would be healthier, I would feel like I looked better. If other folks, if us as helpers are the ones to share those ideas of, well, you know, if you started eating better, you would do this, that, and the other, it feels like an insult. But if somebody's given me space to talk about why it's important to me, and then it's reflected back like, oh, well, so Megan, what you would hope is that if you are eating better, that you would feel better and you would feel more attractive, then it's not an insult in the same way. So that idea of like opening up the conversation and then reflecting back to people what it is they want is really powerful and changing the dynamic of that relationship. Then I don't feel like somebody else thinks they're the expert or they don't think I know these basic things. Often for individuals, we're not changing because we don't have enough information. We usually know a lot of the important information. People know smoking is not good for them. People know abusive relationships aren't healthy. We're not changing because we need somebody else to tell us it's bad for us. We're not changing often because we don't feel like we've really figured out how to, or that we have the capacity to. And having somebody to talk through it with is sort of the magic and hope of motivational interviewing, is to be able to do that in a super safe place. I want to show a little video. So this is a video of Steve Rolnick, and it's a role play that he does around motivational interviewing in healthcare. So Steve Rolnick is one of the authors of the motivational interviewing book, him and Bill Miller. And I really like this video a lot because he, of course, shows the spirit and skills of motivational interviewing well, but he also was very direct, and he's assertive about going after change talk with this gentleman with a topic that the gentleman didn't bring up. And so you'll see that it starts out as sort of a medical visit, and then Steve Rolnick is bringing up the gentleman's health, his weight, and his diabetes, I believe. And so I think it's a good example because motivational interviewing is evocative. It's not like super soft and squishy. though it's a very respectful and compassionate engagement. So it's about a 7-minute video. I'm going to stop sharing so that Caitlin can share, and then I will come back.
I don't think it's the case that people are either not motivated or motivated. And in fact, motivational interviewing was born from conversations with very, very difficult people who were classified as not at all motivated to change and very resistant to treatment. Well, Mr. Smith, that's your medication sorted out.
Good.
Blood pressure's a little on the high side.
Yeah.
Okay. I wonder if I could raise the subject of your weight.
What?
I wondered if we could spend just a couple of minutes talking about your weight.
You are joking, aren't you? I mean, look, I've made time in my day to come here.
Yeah.
I'm kept in your waiting room for 45 minutes.
Yeah.
It's not acceptable. You know,
Yeah.
if I make an appointment with a client for 10, I expect them to start at 10, not quarter to 11.
Right, and so you're busy enough. And
Yeah, I've got other things to do. I've got accounts to do. I've got clients that are coming in.
Yeah,
You know.
and it wasn't necessarily easy for you to make the time to come down, and you had to wait in the waiting room. And now I raise the subject of weight.
Yeah,
just
I mean,
when you're
okay,
thinking of
fair
going.
enough. I've got to have my blood pressure medication
Yeah.
changed, but I
Yeah.
really haven't got time to talk about my weight. I mean, you know, I'm aware of my weight, I'm aware of the problems, and I'm also aware of the solutions.
Right.
So I don't really need a discussion. It's just I've got too much to do at the moment, you know.
Right, and so it's been a bit of a rush for you coming in.
Yeah.
And I'm sorry about the wait in the waiting
Well,
room.
it's bad form, you know.
Yeah, yeah, that's not easy for you because you'd like to go really soon, and here I am asking you to spend just a couple of minutes with me.
Yeah, but basically I've got things to do. I've got to get back to the office. I've got a pile of work that I've got to deal with.
Yep.
And every moment out of my day means I have to work in the evening or weekends.
It counts.
Or when you're self-employed, you haven't got a choice, you know?
Exactly. It's up to you. Just a couple of minutes.
Well, I'm here now, so yeah, okay, if it's a couple of minutes, yeah?
I promise.
Okay, because I really must get on.
I want to simply ask you how you feel about it.
About what? What, losing weight? Well, obviously, I want to.
Yeah.
Yeah, I mean, who doesn't? I mean, I'm aware that I'm over my balance weight, but I know that it's causing problems. I mean, obviously, I get out of breath if I have to do something a bit hurry, and I realise that I'm on this blood pressure.
Right.
And maybe that's probably contributing to it.
Right. So you can see the links between your weight and your health, and you'd like things to be.
Yeah,
a
I
bit
mean,
better.
there are other things, but I mean, yeah, the weight is something I would like to get hold of, get a handle on. Yeah.
You'd like to if you could.
Yeah, I mean, I know the theories of a bit of exercise on a regular basis, a balanced diet, but unfortunately, because of my lifestyle, because of being self-employed as an accountant, it's finding the time to exercise, but also finding the time to sort of think, okay, I'm going to go shopping for this, that, and the other, and then I'm going to prepare a meal.
Yeah.
With me, it's very often
Ready meals and that sort of thing.
yeah, food on the run, you know, grazing.
Let me see if I can summarize what you've said, and then we'll see what next. You lead a busy life.
Yeah.
You run a business and you've got a lot to do.
Yeah.
You're aware of the links between your health and your weight, and you are concerned to some extent about that. And ideally, it sounds like you'd like to do something about it. It's just that your life is busy and rushed, and you tend to use convenience foods in order to get the work done.
Yeah, I mean, to a certain extent, because of my lifestyle, food is just fuel.
Yeah.
You know, because I'm juggling all these balls and I don't want to drop any.
I get it. And so if you could fit it in, you would like to do something about it. A promise.
Yeah, I mean, I know that to a certain extent, because of my lifestyle, food is just fuel. You know, because I'm juggling all these balls and I don't want to drop any.
I get it. I get it. And so if you would like things to be different, but that's not so easy.
No.
Okay. Can I suggest that you come back and see me in a couple of weeks' time just to chat about this?
Okay, I'm up for that, but it's going to be the same problem of A, finding time,
Right.
and B, if I make an appointment,
Right.
I don't expect to be kept waiting for half an hour or
Exactly.
whatever, because it's...
Exactly. I tell you what might be a nice solution is if you come down first appointment, and I give you an appointment at 8:30.
That'd be good.
Then there'll be absolutely no waiting. And the purpose of that visit will be to have a look at how you really feel about how you could move forward and somehow fit in a more healthier lifestyle into the busy work life that you've got.
I'll maybe have a look at my schedules, see whether
Yeah.
anything can be arranged, or I can pass something
Yeah.
on to some, and so like,
See
so
if-
it's not a wasted interview. So I can come here and say, okay, I've looked at my schedules, I've looked at things,
Good.
whatever.
Good. And see if you can fix it up and also give some thought to what we've talked about.
Yeah, of course.
Good stuff. Okay.
Okay, thanks.
Okay, all the
Sorry I went
best
off a
then.
bit.
A few well-chosen words, a very thoughtful question, can be worth more than many mouthfuls of busy talk.
Well, I want to try to stop smoking.
That's quite a decision.
Well, it is because I've been smoking all my life.
We could talk about adjusting your diet. Okay. We could talk about adjusting your exercise or getting more exercise.
Right.
Or perhaps anything else that you think is relevant. Now, I'm wondering what makes
If you have any thoughts about the video, feel free to throw them in the chat. One of the things that I really like is sort of just that example of how direct he is, and willing to bring it up, but then also really listening to this gentleman kind of share about what's important to him and also his frustrations, and that wasn't dismissed or overlooked, I think was really important. So thinking about for us, what are those conversations that we might want to have with some of our participants or clients? And what are the questions we want to ask, but to ask from a place of a tremendous amount of compassion for our clients and the wish for their best lives, but also a lot of humility around the fact that it's not our life. Okay, I'm gonna share my screen. So our first comment is like how I continuously reflected back to Mr. Smith. Yeah, so that the patient knew he was being understood. It's so easy to skip past that, but it's really the heart of motivational interviewing is making sure people have a chance to be heard, to know that they're heard. So thank you, Jocelyn, for sharing that. Any other thoughts from anyone about the video? Things you liked, things you didn't like? I'm going to move along, but if you have other thoughts, feel free to throw them in there. So there's generally 4 tasks in motivational interviewing, and it's like a staircase. So we're going to start at the bottom. And really, we're starting with engaging, which is establishing a collaborative, trusting, and affirming relationship. And so this is a piece where sort of the ongoing exposure and time that we have with our clients or participants is such a benefit to us in medical respite work that we have a chance to really work on engaging day in and day out. And so it becomes imperative that sort of all of our actions and programs are built around language that's collaborative. So as our clients, move into our shelter with us, while we're here, we want to support you. We want to support you in reaching your health goals. We want to work with you to figure out how you want to best spend this time to make the most use of it. That there's a lot of collaborative language that is setting up from the beginning that we're here to work with you and moving forward in your life. And having a collaborative, trusting, and affirming relationship is also, of course, in alignment with the principles of trauma-informed care, where we look at trustworthiness and transparency, And so there's a lot that motivational interviewing does that helps to support our trauma-informed practices. And there's a lot from trauma-informed care that supports MI. So once we sort of have established a relationship with our clients that is collaborative and trusting, then we look on like really focusing, what are we going to do together? You're here for this time. How is it that we're going to support you in moving forward and reaching kind of greater health? And so looking at that shared direction, some of it is going to depend on what's in our bandwidth to address, right? If somebody's like, I really want to focus on changing my, I don't know, exercise habits, and we're like, that's not something we do, then it may be a referral out to do that work. And so that process of focusing it in is going to be particularly important given who we serve, because our clients often have multiple domains of their lives that they're wanting things to be different, where there's legal problems and they're experiencing homelessness and their health is in the toilet sometimes, and they're using drugs in ways that are detrimental to their health and well-being. So figuring out what are we going to focus on and where do we start can be part of that conversation. Is like, for some people, they want to start with whatever's easiest. Others want to start with whatever feels biggest in their lives. And so looking at how do we help narrow that down. And then from there, we're evoking around that topic and really looking at the client's motivation to change. And these conversations can happen as sort of a longer check-in that a case manager might be able to have, or they can happen sort of in shorter bursts as we're talking throughout the course of a day. Right. So if I have a staff member who's down in the shelter and that just happens to be kind of shooting the breeze with clients, it might be that part of the direction I'm giving them is that when they're chatting with people, to assertively look for and reflect the strengths that they're hearing. So somebody might be talking about what they like to do in their lives, whether it's art or gardening or whatever it might be. And so the direction for our staff may be like, let's build up people's confidence. Let's help them be more aware of their strengths. So if they're telling a story and you realize that they were super like thoughtful and organized about how they attacked whatever problem they had, point that out. If they're using a lot of humor to like get out of awkward situations, point that out. Making efforts to like build up people's awareness of their strengths can be kind of in these shorter moments. And then maybe in some of our check-in conversations, it really is about focusing and looking at, given everything you're facing, where do you want to start and why is that important, and tell me all about it. And then reflecting back on that. So, and then planning is the last task in motivational interviewing. We don't always get there. I find that for a lot of staff, that's where they like to start. They're like, if only this person has a plan, they're going to make every change. But I guarantee you could give me a really good diet plan. I can probably find 50 in the next 12 minutes, right? That have all the meals I should eat. And it's not going to help me make that change. Like there's something else internally that I've got to work through. But when we do get to a place where a client's ready to plan, then our role is to be with them as they're making that plan. So our role is to ask all of the questions to help them color in that plan, to reflect back why it's important, to help look for what kind of supports they need along the way and what could get in the way, and not to build the plan for them, but to kind of guide them through it. So this intervention all the way around is about guiding, right? It's about guiding people into conversations where they're really exploring what they want for themselves, making that a safe place to do that, and then guiding them to how they want to get there and what that might look like, what the benefit would be at the end. So I'd like to have folks get into breakout groups. I want to give you about like 7 or 8 minutes. And I pulled out some of the sort of challenges that we often have in respite care. And I want you to just spend some time with one another, kind of talking about how this approach might change, if it would at all, how these types of situations are addressed in your respite care. So we often have folks who have concerns about our clients' medication adherence. We're not in a role to provide med management, So, shifting from this sort of idea of like, can we require people to take their meds? How do we get people to take their meds? How might that shift? How may it shift whether like conversations around people participating in their appointments, around their substance use, around developing realistic goals or addressing discharge. So I'm going to put these prompts in the chat so that you have them. And then Caitlin will put you into breakout groups. And you certainly don't need to address all of them. I just think it'll be a good chance with one another to kind of think through how, if you think this could be helpful, how it may be. Are there any questions before you go into groups? If so, you can throw them in the chat and I will. There's some folks that can't do a camera or mic. Oh, there's more than one. Oh, there's actually quite a few. We've got a few.
The chat will be open in the breakout rooms, so people will be able to chat within their own breakout spaces. If you're not able to unmute, you can still participate that way. And we have a larger number of folks in the breakout rooms to help kind of buffer that out for folks. So
awesome. Thank you. Okay,
yeah.
well then I think we're ready to go. I will see you guys back in about 7 minutes. Okay. So with all of these sort of areas that came up, part of what we're looking at is like, as we engage with folks from a place of we believe that you want what's better for yourself and we want to help you get there, that, our hope is that motivational interviewing can be one of those tools that you can just add to your tool belt for when it's helpful. Oh my goodness, I love that folks are sharing where they're at in emails. I think that the ability to connect with one another and doing similar work is beautiful. Okay. I wanted to talk a little bit about sort of motivational interviewing use across disciplines and across different cultural groups, because we're all in different areas and serving diverse groups. And it's incumbent on us to make sure that if we're using a practice that we really are being careful that it's going to apply to our clients and be a good fit for folks from different cultural backgrounds. So starting off on the left, motivational interviewing started with substance use disorder, particularly with folks who had alcohol use disorder, but it's expanded tremendously. And, as I talked about before, the evidence base for it is huge, right? So we're now seeing it in healthcare, education, and organizational leadership, which is interesting. Probation and parole officers are being trained in motivational interviewing, life and health coaching, and in sports. So it's really broad. And one of the things that's so interesting to me about it is that while it's an evidence-based practice, it's not manualized. So really it's about how we hold these conversations, which can then be adapted across disciplines. They've done a lot of research on it cross-culturally. And so really looking at, can we actually use this effectively in different languages across different kind of cultural groups? And the response has been positive, that it can be used for different sort of kind of with different groups. And I think for me, a big part of it is that we're not imposing our goals on people. We're not imposing values, a way of living, what's right or wrong, but really looking at helping people identify that for themselves. And that's part of what's really powerful about this intervention, is that it allows us to step out of being this all-knowing person who's going to fix things and into a place of honoring sort of the sacred truth of who that person is and their life on their terms with their values and their strengths and their approaches. Now, if we're working with a cultural group in particular, we are going to want to really look at what are the ways of looking at affirmation, at looking at nonverbal communication, and honor and fit and adapt motivational interviewing to that particular cultural group. But motivational interviewing is used on 6 continents. It's translated into dozens of languages. And so there really is like broad applicability, and there's a lot of information out there on how to tailor motivational interviewing to different particular groups. So I'd encourage you to check some of that out. Oh my goodness, the rest of the slide is like wrong. That's really funny. I pulled somebody's template and didn't fix it. Sorry. Oops. So the next step in learning motivational interviewing is you could learn more about it sort of theoretically. There's a ton of research out there. The Motivational Interviewing Network of Trainers is an international group of people who have been trained to train in motivational interviewing. And so on the website, there's just a ton of information about research, books that are out there, videos that are out there, how coding is done when we look at somebody's conversation and pick it apart to find all of the motivational interviewing skills used and opportunities to use more as a training tool. So that website has a lot of really rich information. There's a lot of in-person and online training happening across the states. On the Mint website, you can find people from your state who do motivational interviewing trainings, not just from your state, from different countries as well, in case you want to go overseas and do it. So that is an option. There is a certain amount of benefit that can come from doing in-person trainings where you really get to get in and practice motivational interviewing. There are also a ton of books. I brought some of my favorites: Motivational Interviewing in Healthcare, Motivational Interviewing in Social Work Practice. There's also our sort of main motivational interviewing book, cleverly titled Motivational Interviewing. It's currently on the 4th edition. There are also like workbooks that people can use to develop some of the skills. And then the heart of learning motivational interviewing is going to be practicing it and getting feedback. So that's sort of the trajectory to know more and to go sort of further if you're interested or feel like it would be good for your folks. There's also online trainings that have become available, or video sets that you can purchase. There's a lot of videos on YouTube. Some are really good, some really aren't. So it's a little bit of a wild way to learn. And that's what I have for you today. Wondering if there's any questions or any reflections that anybody wants to share before we close. Well, thank you guys. It's such an honor to be here with you all. I appreciate the work that you guys are doing so much. Awesome. Well, I don't see any questions. I appreciate all the kind words. I would love a day long, and I think that we should do that day long in Maui. There's somebody, McDonald from Maui. We're going to come visit. We'll do a day long. It'll be wonderful. I'm here for it.
I'm open to sponsorship opportunities for to do motivational interviewing in Maui. That would be lovely.
It'd be good. We could have some like nourishing self-care along with it. Yep, I'm ready. Well, thank you guys all for the work that you do, and thank you for taking this time to be together and to learn a little bit about motivational interviewing. And I wish you all the very best in your day and in your work.
Fantastic. Thank you so much, Megan. This was really great. And I agree. It's good to hear feedback from folks as we think about how we can bring you more content, especially on motivational interviewing, to you all in your work. Just a reminder, the webinar recording and slides will be posted in a couple of weeks to our council website. If you're interested in other opportunities to connect with each other in an informal conversational space, kind of like our breakouts today, I posted a link to the chat for our role meetups. So there's a calendar of when these are happening. You can come talk with other folks who are doing your work in the field with that. And again, if you have any questions, please reach out to us at any time. Otherwise, I hope everyone has a good rest of your Wednesday and hope to see you in another virtual or in-person space soon. So thank you, everyone.
Thank you all.